Dave Stevenson. I'm from Zimbabwe. I have traveled to India to have two knees operated on. My history is that for the last 2 years I've been suffering immensely with knee pains, and I've been unable to climb up or go down without assistance, help from other people. At present in Zimbabwe, if you do not have an external medical aid, you cannot afford to have a knee operation. We have recently dollarized in the country, and this has given us the opportunity with our local medical aids to come outside of the country. I got onto the internet and found Knee India, and I found, excuse the pronunciation, Dr. A.K.Venkatachalam, who I approached through the internet. He was very helpful in all aspects, time and that, because I had a few projects on at work and I had to finish these. I left the country and I traveled to South Africa. I took, with my wife, I took an airplane to Dubai, and from Dubai I traveled to Chennai, and there I entered the Chennai multi-specialist hospital. The doc became a friend of mine, a personal friend, on first name basis, and he operated on my right knee first and then on my left knee 4 days later. The hospital I was in, you could not have asked for better attention, cleanliness, food, to the point that being an outsider of non-Indian descent, the dietitian from the kitchen came and looked after me and food I required. The nurses were in attendance. You just had to press a button. I recovered for 4 days. I had the second knee done. I had an epidural done, and this relieved all the pain for several days. I had the doc there every day checking on me, and on top of that we had the hospital doctor and the shift doctor who came and visited you, and the senior nurse who visited you. So you couldn't have asked for better attention. After that, the doctor recommended that I travel south to a small holiday resort and relax there. I'm at present at this holiday resort, and I am relaxing in good surroundings. I must say that I'm in one of the hottest periods of the year, and the hospital is air conditioned. You have your own private TV. There are a few channels of English which you can watch, and at the hotel here I have the same scenario with television and everything. I can say that my operation attention has been excellent. The doctor personally organized transport for me and has visited me personally at the holiday resort to check up on me. The service is excellent. The main thing is that you do have a trip to travel, but with the cost of medical aid being double in Zimbabwe and not being able to cover it with medical aid, and I might tell you South Africa is basically the same price, I checked it out, as Zimbabwe, that you are looking at a fee where you can do both your knees for the same price as one knee in South Africa or Zimbabwe. I did not take the medical aid because it was cheap. I researched into it. The doctor has a good upstanding record. I approached him. He gave me references. I cross-referenced those on the internet and got a contact with a chap named Chris, who had just had he had a hip operation 2 years ago, and he just had a x-ray, and he told me he was in excellent condition, and he highly recommended the doctor. I can recommend the doctor. I just say you have to get used to a couple of things. One, if you don't eat hot food, and two, the traveling on the aeroplane. If you require any information from me in Zimbabwe, I'm at Zimbabwe, which is code 00263. I have two telephone numbers, 772-516-423, and the same STD, 773-688-061. I can highly recommend coming to India. I've had at least 3 major ops in the last 5 years, and I can tell you that the attention to detail is excellent. I suffer from a rare disease called hemochromatosis, which is a very thickening of the blood, and I can tell you this was picked up. I was checked out. I had other checks done to make sure that all my other bodily functions were well, and the service was excellent. Had both knees operated on, as you can see. The right knee was first. This knee is a knee that during my period of 2 years when I was suffering took a lot of the damage. I can place it at 90 degrees. I'm now about 12, 13 days with this knee operation. I can straighten it to nearly maximum. It's getting there. I should be there closely. I can stand and walk with a walker. My left knee didn't take as much problem. I had this done 4 days later. I can straighten it out perfectly straight. I can hold it there. I can move it any way you want, and this knee is fully recovered. I am shortly due to have the staples out, and I'm sure after that they will relax. I do have a bit of swelling, but I'm told this comes with all operations. And I've seen from one of my relatives who had the operation recently in South Africa, he also had the swelling for a long time. But other than that pain, with the epidural operation, the anesthetist type, I did not suffer any pain. I am well medicated now with not heavy drugs, with light drugs, and I do not suffer any pain. The doctor has organized a physiotherapist where I'm staying down here. He is visiting me on the evenings, and I'm having a session of physiotherapy, and then I'm having the machines, the therapeutical machines on me to do the muscular movements. I'm sure within the next 3-4 weeks I will be walking to a certain degree, and I'm told within 3 months I should be back to normal. I've known of a lot of people, including one of my family members, who said it took him a year to get right on one leg. I'm sure within 3 months I'll be up and walking. I'm guaranteed, other than crossed knees, I'll be running, jogging, and doing normal exercise. I might tell you that my knees have just been through wear and tear. I've done a lot of walking in my life due to my work, and it was just wear and tear which got them to this state. And I had to have them done because I realized that having had x-rays in Zimbabwe, they showed that it was bone and bone, and if I continued, it would just deteriorate to a position where I could not walk. I'm sure, as I said, within 3 months, I'll be up and running, and I'll be in good health. Thank you very much. This is a hotel that the doctor recommended. It is Hotel Mahabs. It has 3 stories, 30 rooms, and on my left it has a very luxurious swimming pool. The dining area is on the back area, and the reception is down the side there. It is very comfortable, nicely laid out, air-conditioned rooms, and the service has been excellent. It was a good recommendation to me from the doctor to stay here. The hotel provided the transport to collect me in Chennai and to bring me here. And on termination of going back to the airport to go back home, they will be taking me back. I can highly recommend this hotel for a period of convalescing after the operation, as I do not suggest you travel shortly afterwards. You need a period of recuperation, a period of say 10 days to recuperate before you travel home, and this is the ideal place to come and spend it. Thank you.